So the next question is, who are these high-cost patients and how do they differ in the different countries? Well, firstly, the majority of these patients are female, and we see that in all countries. And they're not just the elderly. In fact, about 60 to 70% of high-cost patients in the USA, the Netherlands, and Canada are younger than 70 years. And that's what we see in this distribution. In Germany, the gray bars, we see that they have more elderly high-cost patients. But that probably merely reflects their population distribution as a whole. Because if we look at it the other way around and look at the chance of patients being high-cost per age category, we see two things. One of it is that the older they are, the higher the likelihood of being high cost. And the other thing is that Germany, again, the gray bars, doesn't stand out that much from the US and Canada. If we look further at these average high-cost patients, we see that they are clearly have multiple conditions. Here we see the number of conditions from different ICD chapters. And one ICD chapter, for example, is circulatory conditions or mental health. And we see that patients, on average, have between 6.5 and 8 conditions from different chapters. We see fewer clinical conditions in the Netherlands. And then the question is, do patients actually have fewer clinical conditions? Well, probably not. Without going too much into detail, this seems to be a coding issue. Because if we look at this another way and look at the number of different drug categories per patient, we see that an average high-cost patient uses drugs from 8 to 10 different drug categories. And here, one drug category, for example, is drugs taken for diabetes or diuretics.